emphasize, my opponent was at one time the health authority, which is a separate position entirely, which I was not involved in. My job was to take care of people in the hospital. Now, the hospital authority position is a much different. It's the advisor to the community, to the county. My opponent, after not seeking the 120,000 rings, decided to quit on the County of Starr. And that is an important thing that I think needs to come out with the community. And now he's seeking a non-paying position, fighting tooth and nail.
Dr. Vazquez has worked with us for the last 8 months, day and night, because I get calls from him on Saturdays, Sundays, 10 o'clock at night, 6 o'clock in the morning, all during the day. I mean, he's constantly working on this COVID, and I certainly appreciate that and all the work that he has done.
I'm Dr. Jose Vazquez. I am the Starr County Health Authority, and I am the Starr County Memorial Hospital Board President. Coronavirus is an infectious disease caused by a virus that is novel for the human being. Just once again, we have to reinforce to this community that we are taking matters very seriously, that we are actively working in preventing major complications associated to this, but we need the community involvement and their participation in helping us to control this disease. The best way to do that is staying at home.
Getting tested in the public sector has been a problem in Texas. This hospital has a workaround. They're working with a private lab.
The testing has been difficult because initially all the testing material was coming through the state, through TDH, and they were very limited in the resources, as well as they were very limited in the amount of testing that they could be doing a day.
Dr. Jose Vazquez, the hospital's board president, says they found a way around that.
Good morning, everyone. And I just want to, we're having this press conference to give you some results of some tests that have come in. And as we have been saying, and we promised the citizens of the county, as soon as we had any results, you'd be the first to know. So,
good morning. We want to notify the community here in Starr County that we have got the first positive results for COVID-19 infection within our county.
Cameron County has 6 times the population of Starr County. They also have 16 times the number of known infections. Here's Christian Colon with what Starr County is doing to slow the spread.
Required face coverings and mandatory quarantine if you're coming from anywhere outside the valley. These are just some of the measures Starr County officials are using in hope of keeping their positive cases in the single digits.
Moving forward, the steps ahead are going to be hard because there is nothing easier that we are going to be able to do in the future. We have to keep stepping up in our measures if we want to keep the numbers low.
The 8th case of COVID-19 was reported today in Starr County, a man who went out of town and came back sick. Yet there are no cases of local transmission and no deaths reported here so far.
We did not want to expose our personnel to the potential risk of infection from COVID-19 patients, as well as we needed to protect the PPE. Definitely, elective procedures are a significant part of the money that comes in for medical procedures or for medical services that we provide here in our communities. We have had to make some adjustments in the schedules, and some hours has been cut short. However, every employee has kept his job. In our case, we didn't have any COVID-19 patient admitted in our hospital, so we will not be eligible for those specific funds, but we are being eligible for other resources that the federal and the state government have put in place, and we have already received some of those funding.
The hospital district operates with funding from taxpayers. Vazquez says in the 6 years he served on the board, there hasn't been a need for an increase. Not now.
If this was to prolong significantly throughout the time and more patients were getting affected and a second wave was to affect our communities, then we will have to take the decisions needed at that point.
This just into our newsroom, 12 new coronavirus cases to report in Starr County. The total there now at 59. The county also reporting the first death from the virus. A woman in her 80s, a resident of Rio Grande City.
But tonight we are hearing from an employee of the nursing home we reported on yesterday. The issue is testing, varying results, raising questions of which tests are accurate.
That company that tested the employees was Emergency Diagnostic Solutions, the same ones used to run Starr County's mobile testing site. The county's health authority, Dr. Jose Vazquez, gives us a scope of the problem identified through those tests last week.
Last result that they have it was 74.
That's a combination between residents and staff. Since then, Regency IHS decided to test everyone a third time. In a statement sent today, they said they're still waiting on results. They repeated that they've seen inaccuracies in the tests that were administered by Emergency Diagnostic Solutions. Vazquez explained the lab is using PCR tests, the ones that require a swab inserted in the nostrils. Those tests work by identifying DNA strands that match those of the virus.
It's almost impossible to have a false positive, but it is easy to have a false negative. Because a false positive, you are talking about that we are finding the strands of the virus in your nasal sample when they were not there. So that doesn't happen. If it's there, it's there, and if it's not there, it's not there.
As we first reported last night, Hidalgo County's health authority has tested positive for COVID-19. Today we learned Starr County's health authority is also infected. There is also a new push in Starr County to collect plasma from COVID survivors.
So the treatment or transfusion with what is called convalescent plasma basically saves your body from all of the work that you need to put into producing antibodies. The production of antibodies normally takes up to 2 or 3 weeks.
Dr. Jose Vazquez, the Starr County Health Authority, is the latest medical expert to sound the alarm.
We have the need for as much plasma as we can get.
Plasma donations essentially buy time. They can keep a patient from losing the battle and needing a ventilator. Not enough people are donating, not here or in Hidalgo County. The thing is, not just anyone can donate. Only those who've had the virus and recovered can help 28 days later after the onset of symptoms or a positive PCR test result. They must be over 18 years of age and not pregnant. Vazquez himself is planning to give. Last night, he announced he would be eligible.
I mean, once I became a patient myself, I thought, I need to do something more than what I am already doing.
Everyone has been preaching about staying at home, don't party, don't socialize, and yet everyone continues to do it. I have great faith in the citizenship in our community.
Faith that Starr County Judge Eloy Vera hopes drives people to stay home because he can't force them to. In efforts to stop the dramatic spread of coronavirus, Vera is expecting to issue a stay-at-home order. But because of an early order from the governor, no one could be penalized if they don't comply. In an interview today with Channel 5 News, we asked Governor Greg Abbott why he wouldn't give that power to local officials.
There are parts of their orders which they have the complete latitude to enforce, such as the curfew. That is the authority that local county judges always have, including right now. And it's my understanding that I think both in Cameron as well as in Hidalgo counties, they intend to be enforcing curfews. That is one of the strategies to make sure that they reduce the number of people who are out and about.
Governor Abbott adds he will only allow local officials to enforce masks and not gathering in groups more than 10. In Starr County, Judge Vera says staying home helped keep their numbers low early in the pandemic, but that's not the case now.
We cannot continue functioning in the Starr County Memorial Hospital, nor in our county, in the way that things are going.
It's been a terrible situation, Erika. Here, everybody had a family member or somebody that we know that had unfortunately passed away to this terrible disease. We have had families that had lost 3 and 4 members in a matter of a week or so.
Starr County's hospital is full, 28 beds inside, 27 of them holding someone with COVID-19. And it's been this way for a while.
Everybody here knows each other. Everybody here treats each other as family.
In response, the county formed an ethics committee, a group to decide which patients were most likely to die.
To take that difficult decisions and that responsibilities away from the hands of the treating physicians and to put it in a group of people that understand the situation under different points of view.
A week ago, he told us the committee would urge patients and families to seek compassionate, end-of-life care if they had a low chance of survival. Die at home, surrounded by family.
And patients' families are always going to have the last word. We will never do something against patients or family wishes.
Not a problem now.
However, today we had the great news. We did have an agreement or a collaboration agreement with the VA.
Veterans Health Administration will transfer the patients to Audie Murphy VA Hospital in San Antonio.
I will admit, I was reading the news.
Christopher Sandals is the Medical Center Director and CEO for South Texas Veterans Healthcare System. He reached out to Starr County, offering services under the 4th Mission, a federal emergency response following a state's request for help.
But we have built significant capacity here because of where the numbers were headed in San Antonio.
The San Antonio Hospital has around 160 surgical beds and nearly 70 intensive care beds. The entire 5th and 6th floors are dedicated to COVID-19 patients. It's 60% full, but administrators said they can add more beds if needed.
Spent a lot of time preparing, and so we're ready for this.
They're also taking patients from other parts of the Rio Grande Valley.
Well, we feel like we're all in this together, the whole community.
A community stretching 215 miles.
Now we have been able to provide services to every one of the sick patients here.
The Starr County Ethics Committee will be in place, but instead of encouraging families to keep their loved one at home, use drugs to ease death, families will now be encouraged to hope, to try, to fly out of the valley for care.
Dear Starr County fellow citizens, today is a sad day for me. Effective this morning, I have resigned from my position as a health authority for Starr County. I had the privilege to serve you for more than 10 years at the front of the health-related issues at our community. I have given 100% of my work and knowledge to guide you all, especially during these difficult times.
Starr County is left without their top health authority after bad blood between city commissioners and the leading doctor in the county started. Local Train 3 Sydney Hernandez spoke to Dr. Jose Vazquez, who says he had to walk away from his position because it was already being handed to someone else.
I don't need the money. I'd rather have my dignity.
After 10 years as the leading health official in Starr County, Dr. Jose Vazquez has said enough is enough.
I work 7 days a week, 24/7 for the county issues. In the same time, I was taking care of my own medical practice as well as the hospital board duties.
The decision comes after Starr County Judge Eloy Vera proposed a pay increase for Vazquez at a city commission meeting after comparing what Vazquez was making to neighboring health authorities.
He was getting paid just a token amount of $500 a month. $500 a month is what he was getting. And he never complained. He's worked, like I said, the last 7-8 months for that. Now, I don't think it's fair that we have our neighboring counties that pay their doctors in the excess of $200,000 while ours is getting $500.
The money would not have increased taxes or even come from residents. Instead, the $10,000 proposed contract would have been paid for by the Federal CARES Act. But other council members did not agree with the increase.
I move that we deny the contract at this point in time.
Instead, saying Vazquez's position should be given to another doctor who would do it for free.
He told me that he was willing to come and do this job free of charge, and if we had this money to spend, that we could use it to provide medication for the people that don't have
And that's when Vazquez said he knew he would not be getting an increase, but also not be getting support from other commissioners.
The Commissioners' Court decided that to pay for my professional activities was not necessary.
Vazquez says the part he will miss the most is working for and with the people of Starr County.
I thank each one of you from the bottom of my heart. I had enormous show of respect and gratitude from you all. You made this fight worth fighting.
In a statement, Starr County thanked Dr. Vazquez for his service and said, quote, an appointment of a new health authority should be forthcoming. Working for you in Starr County for Local 23 News, I'm Sydney Hernandez.
In the meantime, another Starr County doctor will be taking over without pay until the court meets Friday to decide whether to officially offer him the position of Starr County Health Authority.
To my fellow physician and successor, wish you luck in the task, and I offer my support in the transition. To my fellow beloved citizens, I will not stop this fight. I will continue all my efforts to help and guide you in your needs. The doors of my clinic are open to you all. I will see you as a patient, and I will be proud to treat you. I never stop working in my clinic. I have been taking care of patients during my tenure as your health authority, and now I will have a lot more time to dedicate to do it even more. I thank each one of you from the bottom of my heart. I had enormous show of respect and gratitude from you all. You made this fight worth fighting. God bless you all. Thank you.
Hemos estado recibiendo inboxes cuando la gente está preguntando que aquí en el condado de Starr, aquí en Starr County, nos dicen ¿dónde puedo ir a hacerme el análisis del COVID? Que sea gratis, porque como ustedes los han notado, el National Guard ha venido solamente en los fines de semana. So, over the weekend, ustedes pueden ir a National Guard, ya sea en Roma, donde se pongan aquí en Starr County, y hacerse ese análisis. Pero muchísima gente, y no lo digo por exagerar, el día de ayer y hoy hemos recibido demasiadas llamadas, demasiados inboxes, y me hace pensar, o una de dos, o la gente se está sintiendo enfermo y necesita hacerse el análisis, o la gente se está preocupando porque a lo mejor gente alrededor de ellos están positivos, porque si ha habido más casos positivos, aunque no los hemos visto reportados en los números del condado Starr, en los números oficiales, muchas personas nos han estado llamando. Ok, so, ¿qué le pasó a la clínica que estaba antes allá en el Fairground? Pues esa clínica cerró, pero ok, les quiero decir que esa misma clínica en estos momentos, si usted necesita hacerse un análisis de COVID, usted puede ir a la clínica del doctor José Vazquez. El doctor José Vazquez era nuestra autoridad del condado Starr hace algunos meses, y ahorita la misma clínica que estaba haciendo los análisis sin costo alguno, está haciendo los análisis ahí mismo con el doctor Vazquez sin costo alguno a las personas que no tienen seguro. Si usted tiene seguro, usted puede presentar su seguro ahí mismo, pero si no tiene seguro, ahí mismo pueden hacerse su análisis sin costo alguno. Y les tengo una más. El día de mañana en la tarde, vamos a estar entrevistando al doctor José Vazquez, porque muchísimas personas me han llamado y me dicen, ¿sabes qué, Clarisa? Me siento como que me falta información de lo que está pasando. No sé a dónde puedo ir a hacerme análisis. No sé qué tengo que hacer. ¿Necesito receta? ¿No necesito receta? Guys, don't worry. El doctor Vazquez va a hacer el favor de estar en vivo aquí en La Pistolera el día de mañana para hablar con ustedes acerca de qué es lo que tienen que hacer, a dónde pueden ir y para poder hacerse esa prueba de COVID. Porque nosotros sabemos que mucha gente está preocupada.
Good afternoon, Starr County. I want to take the chance to answer some of the questions that I've been asked about the oncoming vaccination event to be hosted at the Starr County Memorial Hospital. Today, I am proud to announce that we have received 1,000 doses of the COVID-19 vaccine. We are going to be following CDC guidelines and going to vaccinate people that belongs to the group 1A and 1B. We have 4,500 people that had previously registered with the county and are online to receive this vaccine. Since we have just 1,000 doses, we cannot honor all of those people in this list. However, I want you all to make sure that we are going to be following the guidelines and we are going to be fair and we are going to be administering these vaccines to those that need the most. Initially, we will start with people 65 years or older that belongs to the group 1A and 1B. Hopefully, within the next few weeks, we will be able to host other vaccinations events. I want you all to know that the Starr County Memorial Hospital, as well as Judge Eloy Vera's office, are committed to keep fighting for you all and to find more of these vaccines and to continue with mass vaccinations events. Thank you for your patience and stay alert. Thank you.